Checking my sound. How is that? Hello, everyone in YouTube land. We're just checking sound levels. It's perfect. Welcome. My name is David Phipps. I'm the Executive Director of Research and Innovation Services at York University in Toronto, and welcome to the inaugural webinar for the Knowledge into Practice Learning Network. I apologize, I have a subway stop that is being built right outside of my office, so apologies for any background noise. It's my pleasure to host and moderate this, but I'm not the only person who needs to be thanked, and we will get to those at the end. But welcome to this Knowledge into Practice Learning Network. I'm going to start by giving an overview of the network and where we've come from, talk a bit about our mission and values, or the value proposition, and then we're going to turn it over to Vicky, who's going to explain the technology and how you can interact with us by typing through your YouTube channel. And then the core, some of the members of the core committee are going to talk about our roles and our jobs as knowledge into practice learning professionals and practitioners. And then we're going to turn it over to you. We want to hear from you about what you're doing in your roles, personal and professional, and what you'd like to seek to get out of this network. So I'm going to start by telling you a bit about where we've come from. This all started from the UK Knowledge Mobilization Forum in 2015, and that was held in Edinburgh. And please feel free to type into your YouTube channel if you were there. But you might recall that Kathy Howe, who was the moderator of that session, she had an open space session. And the open space session is a wide open session where anyone can talk about anything they want to. And one of the proponents, and it was Anne Wales from NHS Scotland, wanted to talk about international aspects of knowledge mobilization and knowledge mobilization practice. And so she hosted a table that started a conversation. I was part of that table. I hope there are others who were up as part of that original conversation. And we just dreamed about what an international conversation for knowledge mobilization would look like. So that was the spring of 2015. Over the summer of 2015 and the fall of 2015, we refined our mission, our value proposition, our vision, and we did some work that was testing out this technology and developing some of the core materials that the core group was working on, and that brought us to today. So today, I'm going to share with you some of the work that we've done before we get into where we have been. So our vision is that we imagine a world in which daily practice is connected to and informed by research and knowledge for the good of society. That's where we want to be. Our mission is that who we are is an international online network dedicated to sharing advice, expertise, resources, and learning opportunities to help people get better at using knowledge to inform their daily practice. And you will note within both of those, there's nothing about academic, non-academic, policy, or government, or community. This is all about people. We respect all types of knowledge and expertise, and we look forward to participating in all capacities where we can combine knowledges and move those into some form of action. The value proposition is sixfold. So we want to bring together researchers, practitioners, and policymakers intentionally sharing and learning to support our work. We want to support students and early career professionals. Those are both researchers and knowledge sharing professionals. We want to build and disseminate the evidence base for impact and knowledge mobilization. We want to provide a forum where network members can develop opportunities for international collaboration. And we want to advocate the benefits and the positive impact of knowledge mobilization. And finally, we want to engage and mainstream and build momentum around maximizing the impact of knowledge mobilization work internationally. So that's where we've come from, and that's how we see ourselves today. I'm now going to turn it over to Vicky, who's going to talk to you about the technology.
Good morning, good afternoon, everybody around the world who is joining us for our inaugural launch webinar. So I'm just going to tell you, I'm Vicky Ward, I'm based in Leeds in the UK. I'll tell you a little bit about myself in a minute, but for now I'm just going to tell you about some of the technology that we're using for this webinar. If you're watching, you are watching on YouTube, and if you have logged in on using your Google account, you should be able to be typing into the live chat box and communicating with us that way. When I say us, I mean me. I'm currently looking at the chat box and communicating with people via that. So it's me here in Leeds typing. The rest of the group, so David and the other people you will be introduced to, are in a Google Hangout. Now, the link between the Google Hangout and YouTube doesn't quite marry up. They're slightly different platforms. And so what I'm going to do later on is when you start introducing yourselves and engaging with us as the core and organizing group, what I'm going to be doing is going to be reading out some of your comments so that the rest of the group can hear and respond to them. So it's a little bit clunky, but it's a free platform, it's a free technology that we've been able to develop and use. So that's why we're going that way. I am aware that there is a slight delay on what you're typing in and when I can see that. We've got about a 15-second delay on that. So please don't worry, I will get to you. If I don't manage to read your comments out or your introduction out at any point, we are going to be capturing all of the live chat and then sharing that in a document alongside the broadcast later on. So you will be able to see what everybody has been writing and saying, and you will also be able to interact with everybody else who is watching. And I can see that a lot of you are already doing that, which is fantastic. So hopefully all the technology will work okay. If things aren't working for you, just type into the box and I will get to that. So yep, that's pretty much it for me. I'm going to hand back to David and then we're going to hear a little bit more from the rest of the organising group, and so you'll find out a little bit more about the people who are behind this whole thing. Thanks.
Great. Thank you very much, Vicky. I appreciate you explaining the technology. And if anyone wants to type into your YouTube channel right now, feel free, because I'm about to talk about me and you don't need to hear all about me, but we're happy to take any questions at any time as you do type into the channel, recognizing there might be a 15-second delay. So I'm going to talk a little bit about myself using the structure that Vicky has done in her research to sort of describe what knowledge sharing practice is like. So this is my statement. I want to help academic research institutions create tools and services that support researchers as they share and mobilize their knowledge and expertise. I do this by creating institutional tools and services that support authentic partnerships between researchers and non-academic partners in order to maximize the economic, social, and environmental impacts of academic research. So, and that's what I do. I do that for York University, which is in Toronto in Canada. I run the Knowledge Mobilization Unit as part of the Office of Research Services. I also am the KT lead for a national network called NeuroDevNet. It's a research and knowledge translation network on childhood neurodevelopmental disorders, where we're using research to inform policies and practices to benefit children and family living with cerebral palsy, autism, or fetal alcohol spectrum disorders. And York University is the lead for a national network we call Research Impact, or Réseau Impact Recherche, which is 12 universities across Canada who are investing in different institutional supports for areas of knowledge mobilization, community service learning, public engagement, and community-based research. I'm happy now to pass it over to Vicky, who's going to tell you a little bit about herself.
Hi everyone, me again. So I'm Vicky Ward and I'm based here in the UK. I'm based at the University of Leeds and I am primarily an academic, and I'm an academic whose area of research is really around knowledge sharing and how people can share knowledge together. So the kind of work that I do in the current project that I'm working on is about helping health and social care practitioners to share their knowledge, skills and practices with each other. And I do that by facilitating discussions and interactive learning between those people so that they can work out how to provide joined up care to the people that they are looking after. So I'm really interested in creative methods around how people share knowledge. I'm really interested as well in how knowledge is understood and how that's conceptualized between people. And I'm particularly interested in different frameworks that can capture some of that and the processes involved in knowledge sharing. So I'm really all about the processes of knowledge sharing and how people can share practice-based knowledge primarily, as well as research and the kind of knowledge that we have as researchers about how to generate knowledge. So all kinds of practice knowledge. So that's a little bit about me. And I'm now going to hand over to Jill, who is going to introduce herself to you.
Hi, everyone. I'm Jill Fairbank. I'm a knowledge broker at the Canadian Centre on Substance Abuse based in Ottawa in Canada, and I'm involved in supporting individuals who work in the substance use field to make better use of the research and the emerging evidence. And I'm really keen to engage with those frontline practitioners and those experiencing harms from substance use throughout the research process, to really understand their research needs and to target our efforts around answering those questions. And I've joined this network and really keen to meet other knowledge brokers and share our practices day to day as we work with the knowledge users in our communities. And now over to Suzanne.
Hi everyone, hope you can hear me. I'm Suzanne Wilson. I work for a national improvement agency called Healthcare Improvement Scotland, where I'm part of the knowledge management team based in Glasgow. Primarily, I'm involved in supporting healthcare and improvement practitioners to access and use research evidence more effectively by delivering search and summary services so that they can make evidence-informed decisions about the delivery of care, be at a local, national, or individual patient level. I also help practitioners to share their knowledge and experience by facilitating discussions so that they can deliver improvements to their own services. I look forward to networking with you all and learning from your experience as well. And now I'm going to hand over to Lynn.
Hi everyone, my name's Lynn Williams. I'm based at Bangor University in Wales, the UK. I have a clinical and academic background and I now work as a researcher in implementation. So my interest is in the overall process of getting knowledge to day and real life practice. My particular research interest lies with improving understanding of how linking and bridging roles in healthcare can promote best practice. And my work to date has been in that field, looking at what it is about these roles that we can develop and support the implementation of interventions and getting them to work in practice. I'm really interested in how we tailor knowledge mobilization to suit the needs and expectations of different audiences, and I have a little experience in that. So co-production with different people all along the knowledge to real life practice is key, and how we can improve the use of novel and innovative ways in which to do this most effectively. I'm really enjoying being part of the core group and look forward to meeting and talking with you some more later on. Thank you. Now I'm going to hand over back to David.
Thank you very much. Thank you to the core members for their presentations. This is really easy for me as I'm going to hand it over to Vicky because she is going to invite your questions, or I'm going to invite your questions on the YouTube link. And please feel free to tell us first, who are you and where are you sitting? And Vicky will read those out, recognizing there will be a slight delay. Over to Vicky.
Hi again, everybody. It's great to have so many people having joined us. We've got 35 viewers currently on the YouTube channel, so it's absolutely brilliant to have you here joining us for this launch of our network. We've yet to determine quite what that's going to look like, but that's very much what this session is actually about, because what we wanted to do was hear from you about what you're wanting from this network. So what I'd like to invite you to do first off is just to introduce yourself. So introduce yourself to the rest of the people who are on YouTube, who are watching, and introduce yourself to us here in the group as well. And so what we'd like to find out is who you are. So tell us who you are, where you're from, and if you could tell us why you came to the launch webinar today as well, that would be really, really helpful, just so we have a sense of who is there. And as I said before, what I'll be doing is reading those out for the rest of the group. So the first person hot off the keyboard is Krisha Jijic. She's based in Stoke-on-Trent here in the UK. She has a wicked question for us, which is about how should we define knowledge mobilization. Now, I know Krisha, thanks for that. And so, yeah, really tricky question, and might be something that we could certainly look at developing with the group as we move forwards. I think for us here in the group, we're defining it fairly broadly, and so we're thinking about practice-based knowledge and how that is shared and the process of that, and defining that perhaps as knowledge sharing as well rather than mobilization, because I know those terms can be quite tricky for people. So I'm just waiting on more people to say who they are. So Nadine has, oh no, I've got 3 people all viewing together. So we've got Nadine Dunk, Julia Shipka and Pierre Lechane. I hope I pronounced your names right, probably not. They're from the Knowledge Mobilization team at the Canadian Partnership Against Cancer. We've also got Jacqueline Quirk. She's tuning in from Toronto in Canada. She works in evaluation and implementation science at Public Health Ontario. And we've got someone here from the UK who's Susan Hampshire. She is the public health principal at Doncaster Council, and she's got a remit for knowledge use and mobilisation. And she's a PhD candidate at the University of Sheffield on evidence use in local government. So welcome to you, Susan. We've got Julie Bailey, who is an impact champion, health psychologist, implementation, science, behaviour change person. She's based in Coventry in the UK. And we've got Emma Fursten-Kaufman, who's watching with some knowledge broker colleagues, so it's great that some of you have come in groups, and they're at the Evidence Exchange Network at the Centre for Addiction and Mental Health in Toronto in Canada. So we've got quite a few Canadians on the line, and we've got quite a lot of people who are involved in health. Another little group that we've got is from Healthcare Improvement Scotland. So we've got Charis, Laura, Ian and Katie from there. And here's so this now showing that we've gone truly global. We have Julio Hasbun. Completely apologize for pronouncing your name completely wrong. I'm bound to have done. So this person is from Chile, who is working on climate change in the local level with the University of Chile and other organizations, and is very happy to be here. We're absolutely delighted to be welcoming you to this introductory webinar. It's brilliant to have somebody from a different country as well as a different field as well. So welcome to you. We've got Alison Turner, who's from the National Health Service UK. Her role involves developing actionable insights for decision makers based on knowledge from research and practice, and she's very interested in making connections, which is certainly something that we're hoping to do through the whole network. So I'm just going to skip down a few because we've got quite a lot of people on the line. Just skipping to the bottom, we've got Cara Blanchard, who's at the University of Victoria in Canada. She's currently doing research communications and knowledge transfer around palliative care, and she's here today to learn. And we've got a group who are coming up as Ontario Brain, which is seems very intriguing, actually. Ontario Brain. They're members of the Knowledge Translation and Outreach team from the Ontario Brain Institute, which is located in Toronto, Canada. So welcome to you. And also in Toronto, we've got Cara de Corby, who's in capacity building with Public Health Ontario, working to ensure that evidence is incorporated into public health practice. So it's brilliant to welcome all of you. There's a group here as well from Calgary in Canada, from the Calgary and Area Regional Collaborative Service Delivery, a partnership of education, health and human services. So brilliant to welcome you to here as well. And we have another person. We have Nazreen, who is a Canadian tuning in from South Africa. So you might have to tell us a little bit more about that, Nazreen. So working in health policy and systems strengthening at Johns Hopkins with research on E2A. So I presume that's evidence to action. But yeah, I think acronyms aren't always that helpful necessarily. I'm guessing it's E2A, so evidence to action. So looking at particularly on knowledge brokering and utilization, and keen to learn from the group. We've got Catherine, who's here from Ireland. She's in Cork. She works as a practice development facilitator in long-term residential care, interested in ensuring that the research we do is used in practice. And we've got Anne Bergen, who is knowledge mobilization and evaluation consultant working out of Guelph in Ontario, Canada. So a lot of people here from Ontario. I guess that might be something to do with David's connections, but also with a lot of other connections that those of us in the organising team have got. And we've also got Joshua from Kenya, so currently looking at how knowledge translation can be used to improve cancer control in Kenya. And we have Travis, who is a knowledge broker from Gambling Research Exchange Ontario, with an interest in everything K-Star, so everything to do with knowledge, everything to do with sharing it, Travis is interested in. And we've got Shauna Riebling, who's a knowledge mobilisation officer from Wilfrid Laurier University. So I think I've got most people. Oh no, a couple I've missed. And I really apologise about this because I know these people individually. So we have Lynn Carter, who is here. She's currently researching how to mobilise knowledge about ethnicity and health. And I know that Lynn is based here in the UK, not too far away from me, up here in Yorkshire. And we have Kate Weatherow, who's in Ottawa, who works for the Canadian Cooperative Association and is a knowledge management specialist in international development. And she's interested in sharing good practices and tools. Robin Trainer is a knowledge transfer consultant with the Maritime Spore Support Unit, which is the strategy for patient-oriented research. This is an initiative through the Canadian Institutes of Health Research. And we've got Joe Nunnally here as well, who is joining us from Christchurch, New Zealand. I have no idea what time it is there for you, Joe. I'm hoping it's not completely in the middle of the night, but fantastic that you've been able to join us and come and join with us all here. We've got a couple of people from UBC as well, the University of British Columbia. Oh, actually, this is somebody, Charlene Ronquillo, is in dual role, PhD student at the University of British Columbia Nursing in Vancouver, but physically based in Exeter, and an associate research fellow in implementation with the University of Exeter. So really interested, Charlene, I'd be to find out how that works. And so we can see that we're really managed to attract a truly international crowd, which has certainly ticked one of the boxes around developing this international learning network. And it's fantastic to have so many people from around the world joining us here. Okay, so Joan Nunnally, who's in New Zealand, is telling us, group, that she is here. It's 4 o'clock in the morning, her time. So we're sorry that it's such an early start for you. But it's brilliant to have you here and that you've been joining us. Now, we are aware that there are some links with other people as well, and some people haven't been able to access the link for some reason. So hopefully we will be able to, they will be able to get through to us later on, perhaps. But if not, we are going to be sharing the broadcast, so the actual recording of this, really widely, so people will be able to see what we've been talking about as a group. And we're also hoping that people will be able to join in and communicate with us via email about what kinds of things you're wanting to get out of the network. So it's fantastic to welcome you all. It's an amazing international group. We knew that this was going to be popular. We sold 100 tickets, we allocated 100 tickets to this within 3 days. So we knew that this was going to be popular. But what we're really interested in finding out from people now is what it is that you're wanting from a network. Because as we said, we're wanting to offer and set up a global learning network and that can help people learn and think about their day-to-day practice of people who are involved in knowledge sharing. But of course, we didn't want to say this is what we think a network should look like. We wanted a network to emerge. We wanted a network to actually come out of the people who are part of it, and so that it's truly collaborative and has been co-created with people. So we have 3 questions for you. I'm hoping that some of you will have seen this in advance as well. But the first question that we'd like to pose to people is, what is it that you would like from this network, from a network into knowledge, into practice? What is it that you'd be interested in learning, and what is it that you're really wanting to get out of the network? This is exactly where my pause kicks in, unfortunately. Okay, so Nadine is saying what we would like from a network: sharing experiences, sharing resources, and sharing success stories. Okay, so that's great, a great start. Someone else is saying, hope to get out to the networks, ways of better identifying or creating a directory, a grey literature of knowledge STAR intervention initiatives. From previous experience, I know these become invisible as they're not published in the literature. So I think that's quite, those kind of tie in really, don't they, in many ways. So we're wanting to look at capturing some experiences that people have of doing knowledge sharing work. So that certainly sounds like something that we'd probably got some idea around. Susan's agreeing with that, the sharing of experiences, and likes the idea of a directory of knowledge sharing. Has anybody else from our organising group got any comments on that?
It's David here. Particularly the question about grey literature and the fact that this work is often invisible. I fully agree. A couple of years ago, I wrote a blog post saying that knowledge mobilization is like cellophane. You know, it's the thing that keeps everything fresh, but we don't see it. And if you don't see it, that has a number of implications in terms of how do you plan for it, how do you evaluate it, how do you fund it, and how do you write a business plan for something that you really can't see? Because the focus of our practice should be on the research or the knowledge that is on one hand, and the impact that it has on the other, and what you do to connect that evidence to action. That should never be the focus, at least in my opinion. It should be the focus on the knowledge that we have and the impact that it makes. So I think that's a really good comment. And I would look for, I don't know of any other sort of online repositories around that, but that could be an interesting piece to advance.
Okay, so one of the other interesting things that has just come up from that is Anne has suggested that so we've got Shauna suggesting about identifying grey literature, but also with the contact information of people involved. And I guess that's like David's comment about the cellophane thing. So actually a lot of the knowledge about who has who's learned things from these different initiatives, those people will take that knowledge with them. So it's a great idea, I think, actually, to have some contact details for people who've been involved in initiatives, because it's really hard to write down what you've done. Sometimes it's just easier to be talking with people. But another comment that we've got that's come from Anne is about success stories and lessons learned. Now, she's also suggesting the idea of failures as well. and sharing things that perhaps haven't worked so well for people. So that might be a really interesting thing to explore perhaps as part of the network, not only how we can share stories about what people are doing and who those people are, but also perhaps things that haven't gone so well. So I'd be interested to see what other people think of that as an idea, and perhaps if anybody else again from our organising group would like to come in on that, that would be great.
Hi, yes, I think that would be a really great idea. I think if we could do it in some form of storytelling, vignettes, case studies, so that it's something that we can all, share online, and then we could look at it in a more constructive way instead of just focusing on failures, but look at to see what's working well and what might not have worked so well in that scenario.
And if people are interested in reporting on failure, one group that I really like is a group called Hub Ottawa, H-U-B, Hub Ottawa, O-T-T-A-W-A. If you Google them and look for their annual reports, the last 2 pages of each annual report is what they call the annual failure report, and where they report on things that didn't work, but they also report on them in a positive way to say what they have learned from those things that didn't work. So look at Hub Ottawa if you're interested in failure reporting.
Great, thanks for that, David. That's a really useful thing. I'm sure everybody is now Googling away to have a look at that. So other comments that we've got, people are really interested in being able to connect with one another and being able to share, to get opportunities for collaboration. So connecting with people around shared interests, identifying potential collaborations. Alison Turner is saying that that would be a really good thing to do. Networking, learning who's doing what, where around the world. And Susan is in Doncaster is saying something similar, is saying that actually this kind of work is hard work. And so having a space for reassurance and peer support as well as gaining connections would be a really good thing to do. But it certainly seems like a central directory of people doing work around knowledge sharing seems like a really good thing that people would be really interested in. And the idea of a way to get feedback from group other people really quickly. So that's very seems to be going down well as an idea. Other people have said learning more about the different types of roles that knowledge sharers play around the world. And just kind of having a quick scroll down here now. So we've got a bit of a theme around evaluating the impact of knowledge mobilization and knowledge sharing that could be transferable across international boundaries. So that might be a good that's another thing that several people are writing about, is actually about the evaluation of this, and whether that's about ways of evaluating or evaluating methods for evaluating initiatives, or actually whether it is going to be a way of sharing what works and what doesn't. Now, I think they're two slightly different things there. I don't know what people think of that, whether it's methods for evaluating or what sharing method lessons around what works. I'd be interested to see what people's ideas around that might be. Okay, and again, it's the dreaded pause where I'm waiting for people to type.
Perhaps, Vicky, as other people are typing, I can come back to the question of how to connect to other professionals. And one area, I think we've all used LinkedIn, or many of us will have used LinkedIn before. And I would encourage us to consider, as a solution to be able to connect with peers and search for collaborators, that we might want to start a LinkedIn group. I have found LinkedIn to be a very successful platform for holding discussions. So I will put we've got a research impact discussion or LinkedIn LinkedIn group, and I'll put a comment up there, and we've sometimes had a very robust discussion. And because it's you log in with your personal identification, you're connecting to individuals, not just to institutions. So for consideration, we could consider a LinkedIn group as a means of connecting to peers and to colleagues and to potential collaborators.
Okay, that's great. Thanks, David. I've got a few comments about measuring impact, and so people seem really interested in ways of measuring impact and in sharing knowledge and learning around that. But leading on from David's comments and now starting to talk about how we're going to go about connecting, I think that it's a really good point to think about how some of the mechanisms really by which we might connect with people and what we might do. So David's put the idea of a LinkedIn group. We've also got ideas coming forward about using an email listserv as a way of keeping in touch rather than having people having their details published on a website. But so it does kind of lead me on really to the second question that I've got for people. Oh, no, it doesn't, actually. That's not true. I was going to say it leads me on to how do you want to engage with us and how do you want to engage with network members. But the other thing we did want to discuss with people is what kind of topics would you like to discuss or hear about? So apart from the things that have already been mentioned, so around evaluating impact, around different tools, around different approaches, are there any particular topics that people would be interested in learning about through the Learning Network, perhaps through something like future webinars and things like that? What kinds of things would people be interested in actively learning about? So what kind of topics do you want to discuss as part of the group? It would be brilliant again to hear from people if you could on that.
It's David here, filling a pause again. But in terms of topics, I do think the idea of evaluation is something that we could look. It would, if anyone has recommendations of people who they think would be speakers for that session, we would welcome that suggestion.
Okay, so we've got a suggestion here, which is about learning from approaches beyond health. And this is certainly something that I've noticed, is that we do end up quite often very much in a health bubble around knowledge mobilization. So, and several people are saying, what can we learn from outside of the health sphere? So people are really wanting to make sure that we can get some insights across a broad range of different areas, I guess. So we've definitely got the evaluation and measuring impact thing going on. So this is definitely something that we will be looking at future approaches. But so Alison Turner has just put forward another idea. She's saying she's interested in how others are balancing demands for rigor versus timeliness. So we're looking at more dynamic outputs, for example, living reviews, evidence maps. So interested to explore that with others. So I guess this is looking at how people want to access various forms of knowledge and how you might provide things to people in a just-in-time way, I guess, is the kind of approach that that Alison is interested in there. So whether that's something that we would be able to do as a network, and I don't know whether perhaps Suzanne has got any ideas around that and what that might look like.
Hi, Vicky. I'd certainly be interested in that last point that was made around going beyond health. And I would certainly say from a UK or Scotland perspective, going beyond the public sector and hearing more from the private sector in terms of what they do in terms of knowledge management and knowledge sharing and mobilization. So I would be quite keen to hear from there. I've got colleagues who work in private sector, and I'm aware that the way things work there, project management is very more demanding than it often is in the public sector. So I'd be keen to hear from that field as well.
Okay, so I think we've got some really good ideas here about the kinds of things that people are looking for. And thank you so much to everyone for typing all your comments in. I know it's quite time consuming to do that, but it's been brilliant to get that kind of feedback from you. And it's something that we'll certainly can then take forward and look at all the suggestions and all the comments that have come forward. And so then the final question that we've got for you is around how do you actually want to engage with us and with other network members? We've mentioned the LinkedIn group. We've mentioned the idea of having other webinars. Are those kind of things that would appeal to people? Is that a way that you would like to stay in touch and you would like to connect with this network? Or are there other things that you'd be interested in doing and being involved in? So what do you think the process might actually look like, the process of engaging with us here as part of the network? It would be great to hear from people again on that. And in the meantime, what I'm going to do is just post a couple of suggestions from some of our core group members into the YouTube group about the kinds of things that we were saying that we were interested in getting from the network as well. So I'm just doing that now. Some of you should be able to see that. There we go. So those are some of our suggestions of what we're wanting from the network as well, so that we've got that. But how would you like to connect with this new fledgling network that, quite frankly, we're not quite sure how it's going to look once this launch webinar is done? Okay, so Kay Weathero's got a suggestion for us, and so she's interested in curated theme-based webinars hosted by speakers who practice or who implement. So I guess by that, Kate, you mean not necessarily academics who are doing research into things, but very practice-based. Catherine is also agreeing, is saying a webinar is a good forum if we can all use it. The UK Chain Network is a good platform for developing groups with the same or similar ideas, maybe have something like that. I'm not sure whether the Chain Network that is run by the NHS here is accessible around the world or not, but it's certainly something that we could look at, because that's been mentioned a few times by people here in the UK. So we'll look at that. So here's an idea from Jacqueline. Could we do a sort of rapid rounds sharing sessions, perhaps organised by topic? Could give people opportunities to share what they're working on, connect on common challenges or successes. I really like that idea, Jacqueline, and I think that would be really interesting. So doing something around that we're doing something quite quick where people are just talking about what they've been doing would be really good. And I assume that you mean by that would be good to do something, it would be good to do something online, so in a sort of webinar forum or something like that, or perhaps a Google Hangout. I think we can get up to 25 people into a Google Hangout to actually interact via that mechanism. So that's something that we could look at if we've got those numbers of people. The LinkedIn group idea is being liked by people. So possibly somebody said they enjoy the hashtag KMB chat. Don't know if we want to do something similar or work with them. I guess actually a Twitter chat might be a good way of doing that. So yeah, somebody else has put tweet chats are a good idea. So that's another way that we could certainly look at doing that. And then someone else has said case study videos, so short videos or case studies. You will have seen, because you're joining us, we actually now have our own YouTube channel. So that would be somewhere that we could upload videos from people about the work that they're doing. Might be a good way of people being able to demonstrate things as well, actually a bit of a show and tell or something like that. So that would be a good thing to do. Somebody's suggesting that collaboration space, document database and sharing might be a good idea as well. We've actually got a space already for those of us who are in the core organising group of the network, but there's no reason that we can't share things more widely from that, so we could possibly look at that. What do people think as well about the idea of a website, perhaps, rather than or as well as another space? We were looking at developing a WordPress website, whether that would be something that would be a good way of people actually connecting. Sean has certainly said concentrate on making things very, very discoverable, so that might be a way of doing that. So that could possibly be somewhere where we could cite a lot of these things, would be in a WordPress website perhaps. Krish has said it would be nice to keep a distinct identity from other initiatives, I think, which we all agree with on the organising group. Ways to present sticky problems and have real-time solutions would be great. So a bit of a problem-solving network, problem-solving mechanism would be really good. So people are liking the idea of the website, especially if there's some collaborative space. So what we may need to do is link various different collaborative spaces to the website. But that could be something that we could certainly look at doing, which would be, yeah, that would be quite relatively straightforward to do, she says. Yeah, and several people are liking the idea of the problem-solving focus. So actually giving people a mechanism for solving problems and contacting one another, and we can certainly look at different ways of doing that. So, so you've given us absolutely loads of ideas and loads of different approaches that we could use, things you're interested in learning, things you're interested in finding out and sharing. Ways of connecting as well, which is brilliant. So we've got some really great creative ideas there from people. Now, the other thing that we really do need to do, though, is that the organising group, as David explained, we came from the UK Knowledge Mobilization Forum. And we are a relatively small group, and we are going to be looking for other people who can actually help to develop the network. So people who can get involved with helping to lead some of these things or taking some of these ideas forward, working with the people who are already part of the group or with other people more widely. So it would be absolutely brilliant to hear from anybody who would be interested in taking on or developing that kind of role. So if you're interested and able to help us with developing the network, it would be brilliant to hear from you. We meet we meet online, obviously, because the core group at the moment, we're spread right around the world. So we organise our meetings online. We meet maybe around once a month. That depends obviously on what we've got going on, but it would be brilliant to hear from people. Now you can either type into the chat box to let us know, the live chat, if you're interested in that. We'll have your contact details because we've got you on the Eventbrite list, or you can email us directly, and we do have an email address that we've got set up, and I'll share that on a slide at the end, so you can email us and let us know what you'd be interested in helping with and how you'd be keen to help. You can tweet us, so Lynn is in charge of our Twitter account, so you can tweet us. So in any of those different ways, you can let us know that you'd be interested in joining, interested in helping with this emergent network and thinking about where we go from here, because we do want it to be collaborative. It's a network of people. We're interested in learning people. And we're interested in getting things from the network as well. It's not just about a group of us taking charge and saying what we think needs to be provided. We want to be part of this as well, which means that we want it to be collaborative. We want it to be about learning together. I think that's one of the main things that we're wanting to do. So thank you to those of you who are signaling that you're willing to help. That's brilliant. If other people would like to do so, as I said, tweet us, email us, get in touch with us, and we will take it from there. So I'm going to hand back to David now, because I have done way too much talking in this thing. So thank you very much for engaging in that, and I'm going to hand back to David.
Thank you very much, Vicky. You haven't done so much talking. All the talking you have done has been putting voice to or words into the voices of 38 or so people. So thank you very much for that. So it's my pleasure to say thank you to everyone who's been involved in today's webinar. We have folks from Europe, from North America, South America, Africa, and Australia. So the only continents we're missing, and we'll do better next time, is from Asia and Antarctica. I'm not sure about Antarctica, but I'm pretty sure we could get some folks from Asia. I do thank the core group for the work that they've done bringing us to this point. Thanks to Anna, who's been working on the website. Thanks to Lynn, who's been supporting on the Google Docs and on Twitter. Thanks to all the participants, and my biggest huge mwah out to Vicky for all her leadership and bringing us to this point. Thank you, everyone. I look forward to staying in touch.